everybody, welcome to Dr. Ghost YouTube channel, prepping PG entrance one topic at a time. Please like, share and subscribe. Hope you enjoy.
Students, now we'll talk about an important biochemistry topic which is asked in INI-CT, that is glycogen storage diseases. So write it, glycogen storage diseases. Okay, so there are many types of glycogen storage disease, but from our exam point of view we need to know mainly 6 types, and those 6 types are, I'll write them for you. The first one is called the von Gerk's disease. Von Gerk's disease. So how can you remember it? Like one sounds like one, so we can remember like one sounds like one. So the first one will be von Gerk's disease. Now the second one is called Pompey's disease. Okay, Pompey's disease. Now the third letter, the third letter alphabetically is C. So this disease will start from C. So it's called C. Cory's disease. Okay, Cory's disease. Also it is known as limit dextronosis. It's based on the name of the product which gets accumulated in the Cory's disease, which are limit dextrans. Okay, now the fourth one, when we write 4, like we write 4 like this, and if we make a out of it, we can make A. So from 4 you can remember A, and this is called Anderson's disease. Anderson's disease. Okay, also it is known as A for Anderson, A for amylopectinosis. Okay, based on the product which gets accumulated, which are amylopectins. Okay, so now the fifth one and the sixth one, we can study them together. Like the fifth one is called the McArdle's disease, and sixth one is called the Hirsch disease. The first important thing is that we have to know the names of these diseases, then we can progress ahead. Now since we have enlisted the names of all the diseases, now we'll talk about the enzymes which are deficient in each of the diseases. Okay, so in von Gerk's disease, the enzyme deficient is glucose 6 phosphatase. Okay, ACE means enzymes. Okay, ACE means enzymes. So glucose 6 phosphatase is the enzyme deficient in von Gerk's disease. In Pompey's disease, the enzyme deficient is called the acid maltase. Remember, there is also a disease in which acid lipase is deficient. Okay, don't confuse with acid maltase. Okay, now in the third, the Cory's disease, the enzyme which is deficient is called the C for Cory's. So we write C for Cory's. The next alphabetically letter is D. So the D wala enzyme will be absent. That is D branching enzyme. Okay. Now A is the first alphabetically letter, and the next alphabetically letter would be B. So here the enzyme deficient would be called branching enzyme. Okay, branching enzyme. Now in McArdle's disease and Hirsch disease, the enzyme which is deficient are similar, which are phosphorylase. But in McArdle's disease, M for McArdle and the M for the disease which will be the enzyme which will be absent is called the muscle phosphorylase. Okay, muscle phosphorylase. And so in the next one, the Hirsch disease, I told you in both the disease we can study together. Both have deficiency of phosphorylase enzyme, and in McArdle's M for M's, muscle phosphorylase will be absent. In Hirsch disease there will be liver phosphorylase which will be deficient. Okay, liver phosphorylase. Okay, thing we need to remember is which is most often tested in exam is like the 3 diseases, like the third one, the fourth one and the fifth one. Okay, no, the 3 diseases, the second one, the third one and the fourth one, these 3 diseases will involve all the 3 organs, which will be liver, muscle and brain. Okay, the first one will only involve the liver, and the last 2, from name only it is clear, this one will involve muscle phosphorylase, so there will be problem in muscles, and here there will be problem in liver because liver phosphorylase is involved. So whenever such question is asked, first look for whenever a question related to glycogen storage disease is asked, first look for what organs are involved. If it's only liver, then it can be first one, that is von Gerk's disease, or the Hirsch disease. If it's all 3, then you can think in the lines of Pompey's disease, Cory's disease or Anderson's disease. If it's only muscle, then McArdle's disease. Okay, now we have to go into a little bit detail of these topics. So von Gerk's disease. Okay, Von Gertz disease. So we already know that the enzyme deficient in von Gertz is glucose 6 phosphatase. So what about glucose 6 phosphatase? Like, this enzyme is the enzyme which breaks down glucose 6 phosphate. Okay, glucose 6 phosphate into glucose. That's the work of this enzyme, which is deficient in von Gertz disease. Okay, so what happens is, when this enzyme is absent, glucose 6 phosphate cannot be converted to glucose, and actually whole body needs glucose as its source. And when glucose 6 phosphate glucose 6 phosphate cannot be converted to glucose, what happens is the glucose which is we get from breakdown of glycogen, this is inside a cell like a liver cell, okay, like an hepatocyte. Now we are not able to convert it into glucose, so so inside the cell, this glucose 6 phosphate will be trapped. Glucose 6 phosphate cannot get outside the cell without being converted to glucose. So the whole body is in the state of starvation because it is not getting glucose. All the glucose which is formed by gluconeogenesis or by the glycogen breakdown, that is glycogenolysis, is being trapped as glucose 6 phosphate inside the cell, inside the liver cell, and the body cells cannot get the glucose. So body cells are in a state of catabolism, and so there will be since there will be no glucose, the kid which is having this von Gertz disease will suffer from various problems like severe hypoglycemia. Okay, and since this glucose 6 phosphate, which is broken down product of glycogenolysis, which takes place in liver, is not getting expelled from the liver because it is trapped inside the hepatocytes, there will be massive hepatomegaly. Okay, then since the cells are not getting the cells glucose, they will produce ketone bodies, so there will be ketosis. Similarly, then there will be hyperlipidemia, lactic acidosis, and hyperuricemia. And the last point, which is very important from exam point of view, they will mention something like moon or doll like faces, doll or round faces. Okay, this will be a hint which will help you to reach the diagnosis. Okay, so this is the problem. Now about type 2, type 3, and type 4. I told you, if these diseases is what they are asking in exam, they will give that all the three organs are affected, that is the liver, that is the muscle, and the brain. Okay, so if all the three are affected, we can conclude that it is either type 2, type 3, or type 4. Now further, how to differentiate whether it is type 2? If they mention something about lysosomes, it will be type 2. Okay, because type 2, the Pompe's disease, is also a type of lysosomal storage disease. We will study about it later in upcoming videos. Okay, if they mention anything about accumulation of limit dextrins, okay, then they are talking about type 3. And if they mention anything that there is an accumulation of amylopectins, then they are talking about type 4. Type 4 is also a most dangerous one, so you have to remember it. The patients die at an early age in type 4, so it's most dangerous. Like, you might have heard of MD Anderson Hospital, so from that you can remember that people who get amylopectinosis are admitted to Anderson's Hospital and they die very quickly. So it's one of the most dangerous types. Okay, now we'll talk about type 5, which is McArdles. Okay, McArdles, only important point you will remember to recognize that they are asking about McArdles. One will be that only the muscle will be involved. The other point you can remember is there will be a characteristic feature, which is lactate will be normal when after exercise, because there will be no breakdown of glycogen, so there will be no lactate produced, there will be no glucose available because the phosphorylase is absent, and hence the lactate, which is usually increased after exercise in a normal human, will not be increased in McArdle's disease. In other words, it will be normal after exercise. Okay, the other type, the 7th type, actually sometime asked in your exams or in GTs, which 7th type of glycogen storage disease is called the Tarui disease. Okay, and it is due to deficiency of PFK1 enzyme, that is phosphofructokinase 1 enzyme. Okay, this is the only thing they ask about the Tarui disease, not that much important. Okay, now in this year in INI, that is 2025 July session, they asked one question about glucagon challenge test. Okay, it's called glucagon challenge test, also known as glucagon tolerance test. Okay, tolerance test. In this, what happens, we give an injection of glucagon and we check for the blood glucose level. Injection glucagon, and then we check for blood glucose level. Okay, remember, in this is only to differentiate between, mainly to differentiate between the two main diseases, which will be the type 1, that is the von Gog's, and type 3, which is versus type 3, which is the Cory's disease. Okay, what happens, even if after an overnight fast, okay, if any of the glycogen storage disease we take except these two, like we can take the 2, the 4th one, the 5th one, the 6th one, the 7th one, or any we take, what happens if after an overnight fast, okay, so after an overnight fast, if we give an injection glucagon, okay, injection glucagon, what happens is there will be a normal rise in blood glucose level, because glucagon is an antagonist of insulin, which promotes the rise in blood glucose, like it promotes the catabolic pathways. So there will be an increase in blood glucose level, which will be normal. But this doesn't happen in von Gog's and Cory's disease. Even if after an overnight fast in von Gog's and Cory's disease we give injection glucagon, there will be not a normal rise in blood glucose level. It will rise very less. So how to differentiate between those two? We give in von Gog's, in Cory's disease, we are giving injection glucagon again. Okay, injection glucagon, but this after 2 hours pp postprandial. Okay, rise in normal, rise in blood glucose level. Okay, but even after 2 hours postprandial, if we give the same thing, which will be injection glucagon, there will be not the same response. There will not be the rise in blood glucose level. So to summarize, we can tell about, in all the glycogen storage disorders except the von Gog's and the Cory's disease, even after an overnight fast, if we give injection glucagon, there will be a normal rise in blood glucose level. Okay, but in von Gog's and Cory's disease, after overnight fast, if we give injection glucagon, there will not be a normal rise in blood glucose level. So how to differentiate between von Gog's and Cory's disease? In Cory's disease, what you can say is that after 2 hours postprandial, okay, what happens is there will be a, if we give injection glucagon, there will be a normal rise in blood glucose level. But even if glucagon is injected 2 hours after a meal, or after the patient has given a substantial meal, even if we give injection glucagon, there will be no normal rise in the blood glucose level. So this time they asked about this glucagon challenge test. Okay, that was all about glycogen storage disorders, which is a very important topic for NEET PG as well as for your INI, coming INI.